Good morning, guys. This is going to be Principles of Health Science, Healthcare Systems Lecture Part 3. This will be the final lecture talking about healthcare systems, history. It's not going to be that long, maybe 10 minutes, 15 at the most. Sometimes I get a little long-winded. Hope your day is going well. Let's take a look. We're going to pick up on Chapter 17 with Telemedicine. Back at the time that this book was written several years ago, telemedicine was something that was thought of, that was being used just in certain areas. And we're seeing today in COVID, during the pandemic, we're seeing more and more of telemedicine, that we're able to talk to our doctor, see our doctor using our smart devices, using our laptops, telephone conversations, those things. One of the reasons is to create social distancing, decrease the risk of disease processes, or infectious disease processes. But telemedicine involves video, audio, and computer systems to provide medical and or healthcare services. I've used telemedicine 2 or 3 times myself. I think it's awesome that I'm laying in my bed, I'm sitting in a waiting room with my smartphone, the doctor comes on, and one of my experiences, he was sitting in his either living room or den in his recliner, and we were going over the information, and then he did his assessment. I explained everything that was going on, and then he called me in a prescription to the pharmacy of my choice. It was a wonderful visit. It went really well, and then I didn't have to do anything but go out to the hospital, or in some cases, when I say hospital pharmacy in Pikeville, you can do the drive-through, which decreases your exposure. And now, in places, you have pharmacies that will deliver or offer curbside service. So telemedicine is really good. Let's talk about wellness. You'll find this on page 18, or on page 18 and 19. Wellness, or state of being in optimal health with a well-balanced relationship between physical, mental, and social health. It's another major trend in healthcare. Again, I quote Benjamin Franklin, an ounce of prevention is worth a pound of cure. If we can prevent it from happening, it's better for us. So what kind of wellness are we talking about? Physical wellness, emotional wellness, social wellness, mental and intellectual wellness, and spiritual wellness. Holistic health, or care that promotes all those together. You're just not parts of a person. A lot of times we treat people individually, that this part will treat the medical, but you have the emotional and the spiritual side of things, the mental health side. So we want to take the whole person. Some of the things too, when we talk about wellness, alternative or complementary therapies of healthcare. Alternate therapies could be acupuncture, Chinese medicine practitioners, chiropractors, homeopaths, hypnotists, and neuropaths. Now, this is things that are out there. Just by mentioning them, I'm not endorsing any one type of alternate health. But what I am saying, be aware that there are people who seek out these individuals who have an expertise or a knowledge of these other modalities for care and treatment. One of the things too that I find interesting is that I'd read an article where that people who are receiving chemotherapy, they brought in a massage therapist or a reflexologist, someone who would manipulate and work on the feet during the time of the chemotherapy. Now, it was, from what I understand in the article, it was a limited study, but they were given a lot of medications for nausea. People, getting chemotherapy, you're feeling sick, having a sick stomach, and they were given medications, and somebody came up with the idea, what if we were massaging or working on the pressure points in the feet? And they started doing that to patients in their study. And they said they had a decreased incidence of having to give medications for nausea and vomiting related to, and how that the person felt while they were doing the administration of the chemotherapy. So I believe that those are things that can benefit people, benefit patients and stuff. So that was just one thing. Again, those are alternate therapies. Page 20 and page 21, there's a table. Table 1-2, excuse me for a moment, let me get a drink. That has a list. You'll have the therapy listed. You'll have the basic description of each therapy. And there's an entire 2 pages, page 20 and 21, list of alternative and complementary therapies that you can look at. Now, the National Healthcare Plan, because of the high cost of healthcare, we look at what the goal is to reform healthcare, to make it more streamlined, more cost-effective. Medications, you know, there's people who might be able to see a doctor, but their medication is $400 a dose. Which seeing the doctor and getting prescribed the medication, if you can't afford the medication, it doesn't do you any good. So they're looking at, and pharmacies have come on board, and I've seen programs just recently, they advertise on media, where if you can't afford your medication, contact them. They're able to give discounts and help people who need help with medicine. So those are something that you can look at and will be explained there. Now we're at page 22 and 23. We're at 5 minutes, 52 seconds on the video, and we're just about finished. So with that being said, you'll see that there's an area here on page 22 at the bottom right. It says Internet searches. Those are always things to look at that you have the option to do. With that being said, then you come into the review questions. Questions 1 through 8, you'll find those on your assignment. So that's the end of chapter 1. If you have any questions, comments, please send me an email or give me a call here at school. Guys, we have finished chapter 1. Now, there will be an exam, but we're not going to talk about exams yet because you'll be back in person on Monday, the 28th. And then you'll have the entire week, because we're going to have some other stuff we need to work on. We're going to, even though we've done some safety stuff online, we're going to go quickly through some review safety here. Even though you've taken an exam, had some assignments, we're going to we're going to review those things in person. We'll do an introduction with the class as well, as far as who we are, why we're here, what are our goals or aspirations, what you want to be when you grow up. And I can tell you right now, I haven't decided what I want to be yet. So, guys, have a great day. Stay safe and well. Till next time.